Hi everyone, I'm going to give you an update. So, I want to make sure I had more information on everything. I'm still in the hospital. It might be another week, might be two, they're not sure. Maybe sooner if I'm lucky. So, we're working on some different things. Right now, we're just trying to be able to swallow food. That's a big part of it. And they're testing me. We did a lot of scans and we're doing a lot of blood work today. Today is the big blood work. They're testing to see my levels on the cancer. So waiting to hear back from that is going to be a lot. See if the M spike came back, if the inflammation is causing a spike, and a lot of other things. So I been feeling better. I'm getting better every day. I did an oxygen test the other day, so I have to be on oxygen whenever I walk or I move. I have to have 3 liters, so I'm going to be carrying around oxygen for a while. That's because of the aspiration during surgery and everything. Had a nice long talk with my doctor, and obviously we talked about reversal. I'm too fragile to go through any kind of surgery right now. So we're looking at 3 months. In 3 months, he said he would be willing to reverse. All my doctors are for it. He said that he feels very confident and it would be okay then to do that as long as my body pulls back. And he said, see what happens, because maybe everything will mellow itself out. We're not sure yet. I just can't have this happening in the future or more blockages or anything like that. Sorry, having trouble with esophageal spasms. So there's just a lot that's happening, and it's just literally one day at a time, and see what happens with it. But reversal in maybe 3 months. See what my cancer blood work shows today. Keep trying to swallow things. I'm waiting on blended eggs to come. I'm so excited about that because I really, really, really want to try eggs. So what they do is they scramble them up and then they put them in a special liquid and blend them so I can swallow them. So there's so much, I'm learning. My liver enzymes spiked yesterday. Due to TPIN, which is that bag of vitamins that I was getting, those big yellow bags. So we had to stop them, and we're monitoring my liver right now to make sure it's not going in a bad direction. So it was something I noticed in my blood work and stopped immediately. So we always got to be our own advocate, even in the hospital. We have to watch for things. All right, thank you everyone. That's my latest update, and hopefully I'll be able to go home soon, as I miss home so much. That was the problem too, by the way. I'm too far away from Mayo by a couple hours. They were going to send Mayo doctors to my house, and they can't, which is why it's enabling me to have to stay longer now, because I'm going to have home health for medical. I'm going to have home health for occupational therapy, and I'm going to have home health for physical therapy. But I can't have this PICC line in without being monitored by like RNs, It's just too dangerous. All right, guys. Thank you so much, and I'll talk to you soon.